Hi, welcome back to the Politico Health Care Summit. The next panel is about health data in the EU, and it will be moderated by my colleague Ashley Furlong in London. So, Ashley, over to you.
Good morning, everyone. I'm Ashley Furlong, and I'm joining you from London, as Sarah said. Before we begin our next session, I'd like to welcome Patrick Ward, Head of Pharma International at Roche, for some opening remarks. Welcome, Patrick.
Thank you very much, and good morning to everyone from Basel in Switzerland. COVID-19 is a tragic situation for sure. But if there's one silver lining in it, it's shown us the obvious gaps in data collection and data sharing and the problems that that creates. The global response to the pandemic has been completely stifled by questions of sharing data, and none of us, including governments, can afford to ignore this problem anymore. Advances in genomics, compared with our understanding of health behaviors, data science, digital technologies, all have the potential to transform healthcare systems, both improving effectiveness and patient outcomes and reducing wasted spend in the system. I think most people will philosophically agree that sharing data for the greater good is a beneficial thing. But there are several big issues that we all need to overcome. Those include data infrastructure, cost, logistics, and more. The infrastructure will require investment for sure, including from governments. There's a cost, but there's so much potential for much better patient benefit, which in the end reduce costs. And in the end, a healthier population is a less costly population too. But data privacy is the real elephant in the room, and it's time we talked about it in some detail. A lot of the debate so far has been framed as a question about the ownership of data. And there's no doubt that the ownership of data is an important topic. But I think we need to break it down more and talk also about other things, other elements that we need to resolve. Robust data privacy and the regulation that's needed to protect individuals from negative effects, loss, damage, discrimination, and so on. The good news, as we see it, is that with the EU drafting a new pharma strategy, it's accelerating the creation of a EU health data space, and that can only be a good thing. I think Europe can emerge out of the COVID crisis as a best practice beacon of how health data could or can be shared to improve healthcare outcomes. We've got a historic opportunity now in the EU to do something which is both practically meaningful and actually truly great and noble. To those who say that it's just too hard, we'll never be able to convince the citizens of Europe of the benefits of sharing health data, I say that we already have several long-standing examples of citizens' willingness to contribute altruistically to improving health outcomes. Think, for example, about how people give blood or donate organs to help those that they don't know and will likely never meet. You don't give blood for yourself. You give it because tomorrow is going to help someone you might not know. And you trust that the system's going to make that happen. When it comes to healthcare and sharing data, there's a real community spirit amongst European citizens. And that's the same spirit we should foster around data. It's important that all of us help people feel confident about their decision to share health data. And then it's important that we all behave in a way that confirms to citizens that the decision to share the data was the right one. Thank you for addressing these topics during the panel. I want to take one last minute to share the Roche perspective on this. As a healthcare company that has served patients with innovative medicines and diagnostics for over 120 years now, Roche has a stated mission to deliver more patient benefit at a lower cost to society. With regard to data specifically, we think that to unlock the wealth of EU health data, there's three core principles that need to be followed. The first of those is an ecosystem approach, where data is shared for broad patient benefit across the entire care continuum. The second is to allow access to and insight from health data to enable personalized healthcare and improved outcomes across the EU. And the third, as I mentioned before, we need strict data rules to ensure that data is secure and that individual rights to privacy are protected. Thank you for the opportunity to open this important panel. And now I hand back to our moderator, Ashley Furlong. Thank you.
Thank you so much, Patrick, for those comments. We're definitely going to get into those issues of privacy, ownership, whether the EU citizens are actually altruistic enough to sign up to this. For our next session, we'll be looking into these issues. But as usual, don't forget to submit your questions via the app and share your thoughts via our poll presented by Roche, which is now live. If you're using the desktop version of the app, you'll see that on the right-hand side, it's under live discussion, and I really encourage you all to get involved. Today, we have a fantastic panel of speakers to dive into these issues. With us from the European Commission is Kerry Thompson, Deputy Head of eHealth, Wellbeing and Aging at DG Connect. From the German Health Ministry, we have Thomas Renner, who is Head of the Directorate of Digitalization and Innovation. And giving us the perspective from the ground is Frank Ulrich Montgomery, President of the Standing Committee of European Doctors. And from industry, we have Jan Willem Skegrond, Vice President of Legal and IP Standards at Philips. I thought I would open with a question to sort of all of our panelists to set the scene for where we are now. And it's a question that we heard a little bit of answer from the Swedish health minister in the earlier panel. She told my colleague Sarah that there had been 1,000% increase in digital health in some areas in Sweden during the pandemic. And I was interested to hear from each of you what changes you've seen during the pandemic with regards to the sharing of health data. Maybe Frank, would you like to start us off?
Oh, thank you very much. From an end user's perspective, I can only encourage the idea of more digital consultations and digital contacts between patients and physicians. In my home country, Germany, we opened up telemedicine and telehealth 2 years ago by changing the deontologic code of physicians. And we also see a tremendous increase during the COVID crisis in consultations by patients. But at the same time, we still have a tremendous backlog on digitalization. For instance, German health authorities still communicate by fax instead of by electronic means. This is stone age of communication. So we see a two-tiered picture, really. There is more improvement on the physician side, on the hospital side. There is the patients that take advantage of new digitalization, new techniques. At the same time, there is a big backlog in digitalization, which we have, and it's a gap which we have to close during next years. I'll leave it at that for now, because I think we get a different perspective from other stakeholders.
Thank you. Kerry, would you like to speak next?
Yes, thank you. Absolutely. I think that, what we've seen very much is that the pandemic has really shown us the value of using health data, how it's got the potential to make our health systems and therefore our societies just so much more resilient. So, we've heard, for example, from some of the actors in developing vaccines that the speed with which they've been able to work has been possible because they're able to access large volumes of, for example, electronic health record data. We've had projects that have managed to rapidly sift, using high performance capacity that's of course so far developed now, to rapidly sift through databases of drug molecules that the pharmaceutical industry have provided to identify candidates that have the potential to be used, to be repurposed for COVID treatment. We've heard from the member states, as we've been very closely involved with them during the crisis, that they've needed to cooperate, both within their health and care systems, because you've had this urgent need to transfer patients very quickly, and even across borders when ICU facility capacity has been reached. And this has also required that the patient's health data goes with them in a digital form. And of course, more dramatically, we've seen the coming together of work by the member states and the Commission working closely together to develop mobile contact tracing apps to complement classical contact tracing, and this has been so I think what we've seen is a massive bringing home of the potential of digital and AI, and this has only served to reinforce the Commission's perspective that this is something that we need to accelerate. And so, even prior to the pandemic, of course, the Commission came forward with a plan to develop a European health data space. So I think what we're seeing now is a realization and much more of an acceptance that there's a need to go very quickly with this. Thank you.
Thanks, Kerry. We're going to get into that, the health data space in very much detail soon. But Jan Willem, would you be able to say from an industry perspective what sort of changes you've seen?
Well, we've seen an acceleration of uptake of digital solutions, like everybody has seen. Logically, we've seen it from the point of telehealth services around the world, in particular in the US, but also in Europe, where the basis for telehealth services were, one, to continue to serve those people that were too afraid to go to their GP or to the hospital and serve them remotely. But two is also to help doctors keep patients that were at risk of having COVID at home if they did not have the symptoms that suggest that they have COVID. So, and at the same time, keep those potential COVID patients securely at home and cared for through digital means, and avoid clogging up of the hospitals and the ICU wards and clogging up the whole healthcare system. We've seen also digitization within the hospital, for example, eICUs, from a very simple level to a very complex level. An example of a simple level is, that the nurses had to change all the time to get into a room to take the vital signs, decontaminate, and it was cumbersome, took a long time, not very comfortable. And it was not always necessary to have to go into a room to take the vital signs if you had a digital solution. So one of the best digital solutions that was really popular was the baby phone. So you call that frugal innovation. But nurses were using baby phones to communicate with COVID patients, to tell them what the readout is on their temperature and their oxygen saturation and those kind of things, to avoid having to go into the room that often. But that is, of course, not the kind of IT infrastructure that we would like to see in the future. But we've seen on the top end of the more complicated ways is that doctors were needing to combine all the data from the CT scanners, from the ultrasound machines, from the ventilators, from the infusion pumps, the patient monitors in one station, a command center, if you like, to keep tab of the various patients in a system where there were way too many patients for one nurse or one interventionist. So the deployment of eICUs or command and control centers in ICUs and also in general wards has taken a massive offtake and has continued the digitization in the hospitals that we saw before that. But also between the hospitals, when patients had to move from one hospital to the other, very often, like in the Netherlands, we saw that data, the patient records were printed out because there was no way of sharing patient information. So when a patient was moved from one hospital to the other hospital would receive the patient and the printout version of the electronic health records. And the first thing they had to do is throw away the electronic health records because it was a contamination hazard. So they knew nothing about the patient, which made it more complex to treat them. So we very quickly developed, as Philips, together in collaboration with the government, a portal where hospitals were able to access their electronic health records for the patients that were transferred. Now, that is something that before COVID would have taken about 2 or 3 years to negotiate. And now it was done in 2 weeks because of the pressure. So we've seen a tremendous acceleration, but we're not there yet.
Thanks, Jan Willem. Thomas, from a German perspective, what sort of changes have you seen?
Yeah, many things were mentioned already, but I think we learned from my perspective, two aspects during the crisis. The first aspect is we would have managed better to come through the crisis if we had better data from the beginning. Just think about outbreak surveillance, vaccine development, or the treatment. I think this is an apparent example where the better flow of data would have helped us a lot. And I think this increases all our emphasis now in creating something like the European health data space, because we really see this is really an outstanding example that shows us that we need a common understanding how to access, how to share and process health data safely. And the other point was already mentioned as well, that during the crisis, we also see that it offers chances and that it accelerated the processes in a tremendous way in Germany as well. Frank Montgomery already mentioned some aspects, and I would just like to add to more. What we did in the last 12 months on a regulatory basis wouldn't have been possible without the crisis. Two examples. For health research projects, for instance, we have introduced the concept of a leading data protection supervisor authority, according to the European example. And in former times, it was very complicated in Germany to have joint research projects between the different federal states, the universities of different federal states. They had to bring the privacy concepts to all the federal data protection authorities. And now we have one supervisor authority that is dealing with these questions. And this helps us a lot to gain speed. And two other points, we just released a digitalization program for hospitals. We discussed about this for years, but now there was this window of chance that we could establish a 3 billion program for digitalization in the hospitals, and this will help us as well to meet the challenges that we are facing right now. The last point, perhaps, it was mentioned already. I think with the Corona tracing apps, you see that if there is the strong will and the mindset to create something together, and then it's even possible in Europe to make something, an interoperability task from the Corona apps within a few months of development. And I think this is a very good example. If we just want to achieve something, then we can do it.
Thank you, Thomas. And we sort of hearing how the speed of how quickly we're able to do these things during the pandemic that wasn't possible before. But Frank was speaking earlier about sort of problems on the ground, sort of faxing health data across, those sort of very basic problems that I'm concerned, will they be able to be fixed by a health sort of amorphous idea of this health data space? Are these problems on the ground going to be able to be solved by that? Frank, your thoughts?
Well, definitely they not only can be solved, I simply demand they have to be solved, because we have no alternative. Give you a very simple example. Had we had a European health data space before COVID-19, we may now have an answer to the question why people in northern Italy died, whereas they survived in southern Germany. The healthcare systems of these two areas in Europe aren't that different that is sufficient to describe the difference in survival rate. But that is the past. I mean, we didn't have the EU health data set then. We are very much in favor of creating a sensible and good EU health data space. But there are some demands which we have on that, which we have to be very, very clear on. And there are three such challenges which we have to meet at the end. The demands are easy. I mean, the whole thing has to be trustworthy. There has to be some sort of ethical standards for the algorithms. There has to be an ethically driven supervisory body that makes sure that the citizens of Europe can believe in what happens there. Secondly, the data has to be safe and secure, unbiased, and it has to be complete. It's no health. You get a tremendous bias by incompleteness of data. The third prerequisite is it has to be equal. It has to be equal access for all stakeholders. And we need some institution, some regulation on who is a sensible stakeholder. That is not only industry, that is also science, that also might be groups of individuals with a very special disease and a very special demand. And finally, from a end user's perspective, it has to be easily accrued, the data. As much general documentation data as we can use is good, and any extra documentation is difficult because healthcare professionals don't have the time for it. That brings me to three challenges in a nutshell. One, we have to train digital skills. Doctors, nurses, midwives aren't trained enough on the digital skills. We have to accept that the second thing is that not every doctor will be able to do everything. We have to have digital leaders in all professions. And all that requires my third challenge, national and EU regulation to make sure that the citizens of Europe can trust the EU health data space.
Kerry, talking about national and sort of EU regulation, I'm interested to hear if you're able to give us, where are we with the health data space? I know it's very early days, but what sort of movement will we be seeing in the next couple of months? Will we be getting any sort of sneak peeks into what it would look like before the end of next year?
Yes, well, thank you. I mean, of course, the ground has been laid already with, this is something that we've laid the ground with in 2018, with the communication on digital transformation, where we already, have some work to start sharing securely health data through the eHealth DSI infrastructure that has developed the ability to share for citizens and their clinicians, patient summaries and e-prescriptions. And then what we've built up more recently is, for example, last year, going to this topic of needing to get an ability to link the health data between not just, frankly, across borders, which would be necessary, of course, to create the volume that we want to see available to artificial intelligence and to really reap the benefits of this kind of technology, but frankly also within health and care systems as well, where often they're regionally based and a hospital in one region cannot talk to a hospital in another in terms of health data, secure health data sharing. So there, for example, we've laid the ground already with last year's recommendation on an electronic health record exchange format, which took stock of where we are with regard to common technical specifications that all the member states can take up and incorporate into their healthcare systems, which lays a foundation for building up a common approach for storing and sharing and securely health data across the EU, which would be essential to create the health data kind of in the volume that's needed for some of the real potential to be reached in terms of using these technologies to develop treatments. And then the recommendation also went further and proposed the next kinds of health data where we need to develop these common technical specifications. And of course, we have a dedicated projects now working with the member states to do this complex and quite time-consuming work of coming up with these specifications. We will also, of course, the data strategy, the EU data strategy was published this year. And this sort of sets out overarching frameworks for how the Commission sees development in many data spaces, of which health, of course, is the critical one we're talking about here, and sets out a frame for the need for the right infrastructures to be deployed, the right enablers to be set up. We need to have these interoperabilities I mentioned, and of course, as was mentioned, the need to have capacity built across health and care system, for example, in terms of skills, as was already mentioned, but also in terms of things like storage capacity and processing ability, because the data is being collected really at the level of the healthcare provider. So that's very important as well. And then, of course, there's a need to have the right governance in place. So this is absolutely critical for the trust, because we need the data to be secure. We need citizens to know they can trust how their data is being used and that they can have a measure of control over it. So this is one thing that the data strategy particularly wanted to put forward, the need that the data spaces need to come up with good governance approaches. And we do see this in Europe happening. We see this, for example, in Finland and in France. They set up things that go along the way towards data permit authorities. And the Commission will shortly come out with another document, a Data Governance Act, which will push this initiative further for strong governance in these health data spaces. And then, of course, looking across to next year, I think during 2021, we will see more development of how we see a European health data space evolving in a number of other areas, particularly taking this broad framework that is the data strategy and really applying it now to the health data specifics of that sector. And of course, in the start of next year would be that the multi-annual financial framework as well, where there, of course, will be resources intended to support this capacity building and need for new infrastructures and investments across the board.
Jan Willem, we have quite a long way to go to sort of get there. Do you think that by the end of next year, that's a sort of reasonable timeline to have this proposal sort of ready, and then by 2025 for it to be up and running? Is that something that is reasonable?
Well, can we afford to be any slower than that? I don't think so. So a couple of things that were happening. Frank, everything you said I agree to, but one thing I don't. You started out with saying that, is it acceptable that we don't know why people in Italy died of COVID and maybe in Germany they didn't, and that we can't share that data? I think we must have that data accessible to us now, not in 2025, if we are still going to be able to deal with COVID now. And so I think we almost need a moonshot to unlock the COVID data as quickly as possible, and not in 2025. And the question is, can we do that as Europe? The second thing that is really a reason for us to accelerate beyond is that governments are now spending a lot of money on digitizing the healthcare sector. So as Thomas was already saying, in Germany, I congratulate Germany on such an ambitious future of healthcare, future hospital program, 3 billion on health IT. So they're laying the foundations now in making the investments for a digital health ecosystem that are being designed and implemented now before we actually have a European health data space. So that is like, and I know the same thing is happening in Italy and in the Netherlands. So now everybody's creating a road infrastructure in their country or in their province, and it's not connected. And so we know that once they have done their investment, we need to start to connect all this road infrastructure, because we don't want the data to stop flowing at the borders, as Frank said. So we really need this fast. Now, I think a couple of things would need to happen, and I'm be interested to get the perspective of the Commission and Germany on that. There's the code of conduct to sharing data. It was already mentioned by Roche. We need a code of conduct on healthcare data to allow us to share data more effectively soon. So on what is personal, non-personal data anonymization, and to get rid of all the divergence in the GDPR implementation and other areas. So there was a thought already of creating a code of conduct on healthcare data. It will be presented, I hope, in November to the Commission. And I think everybody agrees we need that code of conduct. Can we accelerate starting to write this code of conduct so we can responsibly share data for scientific purpose, for primary and secondary use purposes, and we can start sharing data even if the cloud infrastructure is not there already in 2021. So that's one. The second thing is on the European health data space, there is clearly a need for governance, better governance, also at the European level. Kerry was saying there's some governance happening in France and in other countries at the national level, but we need a European agency that can coordinate the data governance issues related to healthcare data. And the question is, start running this as soon as possible. And finally, what we're seeing is, of course, there's Gaia X. Gaia X is the sandpit, if you like, the sandbox, regulatory sandbox of a European health data space. So, and we need a European sandpit, a sandbox to test these concepts out. So will the European Union and the other member states embrace Gaia X to accelerate the practical implementation of sharing data responsibly in a trustworthy way, so that we can finally start making use of the data for the patients, for the providers, and for public health?
Two questions for you there, Kerry. This sort of moonshot idea of actually moving this forward sooner than anticipated, and sharing sort of data from the pandemic. Is that something that would be possible relatively quickly? And secondly, on this code of conduct, would we be able to move that, fast forward that, and have that in the next couple of months? Is that something that the Commission could implement?
I mean, I think it's absolutely correct, as he says. This is a critical piece of the jigsaw to have a code of conduct in place, because we need to have this ability to share data between countries. I mean, at the same time, it's one of these issues where we have to remember what we're building is a very complex thing. And I think I want to go back to the issue of trust. And I think, behind all this, there's a frustration that we can't do things sometimes, but it's fundamentally essential, I think, that we maintain citizens' trust. So there's a need to move at a speed that citizens can understand. We need to accompany, I think, many of these actions with communication to citizens as well, So I think it's always a double-edged sword. There's always a need for speed, but there's we have to do things in the right way that are in keeping with the European values and that keep citizens on board. Because I think at the end of the day, if they do not trust this system, they're not going to want to be part of it. They're not going to want their data to be used for specific purposes. And and fundamentally, the system won't survive. So, I mean, I think there is work happening, of course, in all these areas, and that we hope they will go as fast as they can. But there are also caveats in terms of really accelerating.
Thanks, Kerry. Thomas, on trust, what do German citizens feel about sharing their health data and possibly sharing the health data across borders, sort of in a pan-European way?
Well, I think it was mentioned already, but this is the crucial point. If we want the European health data space to be a success, it is not only a question about interoperability and all the tasks that we have to solve, and there are many others. It is also that it's a task of change in mindset, and to foster the availability of health data, we have to convince citizens, patients, and to some extent even healthcare providers that data can cure. And I think there we have to come up with convincing use cases. And it was mentioned already that they are there. We have good use cases, and Gaia X can present good use cases on one side. And I think on the research side, there are other very convincing use cases where we can show patients and citizens the enormous potential of using health data to improve healthcare provision. And I think this is one task that we still have to go. And what we see right now is, yes, there is a strong will of patients to donate the data if they have the trust in the regulation that is behind a data trust center or anything else. And I think these are points where right now we are working on in Germany to provide data trust centers on one side, but to provide as well the possibility to donate data on a consent basis for other research topics, either scientific research or research from industry, that patients can donate their data. And I think we will succeed this path if we, and this is politics, and this is industry, and this is research, are convincing in the narrative what we are going to do with this kind of data.
And on that issue, we actually have a question from the audience. They ask, they say, at the moment, it is in most cases practically impossible for the patients to access their own health data electronically in Europe and elsewhere. How to make the possibility of digital access for patients mandatory? Jan Willem, maybe would you like to? So we've been speaking about these issues already, but is that something that we want it to be mandatory, that you can access it, your data online anywhere really?
Yeah, I mean, healthcare is local, as we've already heard. Everybody has their own healthcare system. We think that the patient should own the data, and governments have the ability to regulate for that and make that happen. You need to ask the governments what their considerations are that they don't want that. We see that in the Netherlands, the patients own the data, they get access to the data. It doesn't seem to create much of a problem, and maybe that is then related to how do you build that trust? I think that the divergence in these regulations about whether you have access to the data or you don't have access to the data, whether the data is shared or not, and how the data is shared, that is the reason why citizens don't trust it. Because if you have like 200-300 different ways of sharing data in Europe alone, with local regulations, then how is that going to instill trust? Second thing to instill trust is that we've seen that it's always impossible until it's done. And once you are able to show the patients what you can do with that trust and with that data, then we generally see that they buy into it. They want that. They want that predictability and that uniform way of sharing the data, and that solidarity between people, how they share data. So I think the fact that there's divergence, the fact that there are so many differences about do you own the data or not, is a challenge for the regulators, and is one of the foundations why there is no trust. So therefore, again, we need to accelerate that European health data space, accelerate the code of conduct, and accelerate the implementation of Gaia and the healthcare service on the European level, just like we accelerated the creation of a European road infrastructure, decades ago.
Thanks, Jan Willem. I saw Frank wanted to come in there.
Yes, I think we're discussing two totally different things. Of course, it is our philosophy that the individual data belongs to the patient. I think there's no doubt about that in no country of the European Union. And whether you have to have accessibility to other countries, I don't really know. I don't think that is an important issue, because his own individual data is owned by the patient, and the national system has to allow him to access it. That is okay. But we are talking of an EU health data space, and that is aggregated, anonymized, pseudonymized data, which is used on a much larger scale and not on an individual scale for an individual patient. And therefore, the governance structure and the persistence of the public good, which has to be behind it, is so important. And that is why I'm a little bit hesitant about a moonshot, because I know that once the rocket has left Earth, it has to go around the moon, and you cannot accelerate anything, and you cannot change the path. And also, there is a lack of communication on the backside of the moon. So I'm against moonshots, but I'm for a clear ethical standard, for a clear governance, and for a clear code of conduct. But we have to take the necessary time, because 27 countries and their citizens have to believe in it and have to go with it. Otherwise, it'll be useless.
Thanks, Frank. Thomas, this idea of a governance on health data, what would this tangibly look like? Do you have an idea of practically, how would there be representatives from each member state? Practically, how would we go about this? Who would be on that board?
Well, if I got the question right, I mean, this is happening already. That we are sitting together, and the member states are sitting together and thinking about how the European health data space can look like. And that we it was mentioned before that we look in good role models like Finland, and they take a lead role in the joint action. And I think other member states can learn a lot from these kind of role models. And the other point is that we need this platform where we come together and reach a common understanding upon the question, what is our common understanding of the GDPR? And I think right now we are still far from that, and we need this process, and we need yes, we want to have a dynamic process, and we did this during our German presidency of the EU Council, and to push forward different approaches, like to foster also code of conducts and other working groups that have been established to reach a common sense upon the question what is allowed under the GDPR, and to reach a common understanding, because this helps us also in the German government and for the regulation in Germany to bring these ideas back on the national regulation level.
And sort of linked to this idea of trust and keeping data safe. We recently were speaking about Finland as well. There was a cyber attack on Finnish health data, and it was sort of personal data that was a hacker tried to sort of extort mental health patients. And I thought maybe Kerry from the Commission cyber strategy, is that really going to prevent things like this? Would that have stopped this happening?
Well, I think it is a fast-moving landscape, the world of cyber. So I think it's necessary to build up sort of profound capacity really across the EU, and that's that's why the Commission has started to develop an EU framework for cybersecurity, first of all with the NIS directive, of course, which really is, requires there to be some legal measures in member states to really boost capacity, for example, to set up competent national NIS authorities and to promote, to designate health and care providers as operators of essential services. And this is something as well we've put into the recommendation of electronic health record exchange format, is this understanding that for digital health to develop, it's not business as usual for health competent authorities. They've got to really bring on board the data protection actors and the cybersecurity actors, and this is why we've proposed that they set up a national digital health network to do this, and of course this is now being strengthened all the time. We've had a number of actions that we're working on. We've got the strengthening of the role of ENISA, the EU cybersecurity body. We've also got the work to, we're reviewing the original NIS directive now, and we have an intention to come forward with a new cybersecurity strategy for the EU. So, and of course, we understand that this is something that will need resources as well, and this will be many opportunities on the new MFF for member states to invest in these resources across their health and care systems. So, I mean, it's about I think a fundamental increase in capacity and an increase in the frameworks and how this approach is tackled across the EU. If we're to remain vigilant, excuse me, to these kinds of attacks and to stay on top of these attacks, which will be constantly evolving, and that's the nature, I think, of the cybersecurity business.
Thanks, Kerry. We have just a couple of minutes left, so I'm just going to do a quick fire closing round. Just one thing that the Commission absolutely has to get right, or just one thing, the most important aspect of an effective health data space. I know we've spoken about many things, but what's the most important? Frank?
Well, I would say a clear and sound definition of public good, so which is accepted by everyone or almost everyone, so that we are sure that the data is not only safe but only used for public good, important issues.
Thanks, Frank. Thomas?
I would say we need a common understanding and how to access, share, and process health data safely under the GDPR framework, and this is crucial to stop the 27 different ways of living with the GDPR and developing one picture where all we can share data in a better way than we do now.
Thanks, Jan Willem.
So I've said the things that I want before, so that put aside, I think we need to realize that we're in a global competition here on two ways. One is, will we remain the region in the world where we provide the best access to affordable care and equitable care in the world? And the second thing is, will we also nurture a industry that is able to win in the digital services provision of healthcare at a global level? And that is a competition that's currently going on, both the quality of care and the innovation ecosystem that supports it, where we are very much in competition with China and the United States. With that sense of urgency, I think it's important to us all to keep the pressure on and make sure that we come out as winners in this competition for better health and better services.
Thank you. And Kerry, obviously, you're involved in creating the proposal, but one thing that's most important for you.
Well, it's very super hard to summarize all these different aspects into one, how we're approaching this in a very system-wide perspective. So I'll just try and keep it simple. I think we just have to keep our eye on the prize and make sure that we create something that delivers benefits to citizens.
Thanks so much. Thank you, everyone, for your insights. It's going to be a really busy year, especially for Kerry, I'm sure. I'm now going to give the floor over to Gillian, who will be moderating the next panel in Brussels on vaccine misconceptions. And don't go anywhere, as there won't be a break between the sessions. Thank you.
Thank you so much, Ashley. And we're moving right on into this conversation about vaccines, one of the most closely followed, greatly anticipated things in the pandemic. Of course, lots of governments and the public really view this as one of the most important ways to get out of the pandemic, although it is, of course, not a magic bullet. But what happens if we get a safe, effective vaccine approved by regulators, and then people just won't take them? And to address these questions, we have two very well-experienced experts on